Welcome everybody to this Ada Lovelace Institute panel webinar from Principles to Practice, What Next for Algorithmic Impact Assessments. I hope you're having a wonderful Monday, wherever you're dialing in from. We're really excited to be hosting this conversation today. Looks like some people are trickling in, so we'll just kick off with a bit of housekeeping before we get going. So just to let you all know, closed captioning of this event is available if you need it. You need to click CC at the bottom of your screen. This event will be recorded. No attendees will be visible or audible during the webinar, so you won't be able to speak to us directly, but you can ask questions using the Q&A function at the bottom of your screen, and we encourage you to do so throughout the conversation, and we'll dedicate around 15 minutes toward the end of the webinar for questions. If you're a Twitter user, we're on @AdaLovelaceInst, and we'll be keeping an eye on questions and comments as they come in through Twitter. And lastly, just to say we'll aim to get the recording out on our website within around 24 hours of the webinar being completed. Great, okay, so my name is Laura Graves, I'm a researcher at Ada. If you don't know who we are, we're an independent research institute based in London with a mission to ensure data and AI work for people and society. We're putting on this panel as a launch event for our algorithmic impact assessment, a case study and healthcare report that we released in February. And you might be here because you've read the report, or maybe you haven't yet, but you're hoping to use this discussion as a bit of a springboard. So our report is kind of a culmination of our research project that we undertook in partnership with the UK's National Health Services AI Lab, looking at the potential for algorithmic impact assessments to facilitate exploration of social and societal impacts of AI systems in healthcare, led by my colleague Jenny Brennan, senior researcher at Ada, and supported by me. So I'm just actually going to hand over to Jenny now for a couple of opening remarks and a bit of a primer to this conversation. So without further ado, Jenny, take it away.
Thanks so much, Laura, and welcome everyone. We're really excited to have you here to join us. We've been interested in algorithmic impact assessments as part of our Ethics and Accountability and Practice programme, thinking about methods for turning ethical principles into practice and the mechanisms for ensuring that AI and data-driven systems are held accountable to the people that they serve and affect. When we talk about algorithmic systems, we mean a tool for assessing possible societal impacts of an algorithmic system before the system is in use and ongoing throughout its life cycle. With the growing adoption of AI and algorithmic systems across different sectors, disciplines, and domains, people have been looking for ways to transform both the ways that people consider impacts and the ways that we understand them and have other people involved in that process. And so algorithmic impact assessments have been proposed as a potential way for teams to better consider the impacts and risks of systems, for instance, from everything from inequalities in healthcare to public trust in social service systems, and to meaningfully engage the public and affected communities in that process, and ultimately to create greater accountability for AI systems. But there's still a relatively nascent tool. When we talk about an algorithmic impact assessment, we're not necessarily talking about one specific thing. There are many different modes of this. And the panelists speaking with us today include some of the first to use them in practice and explore how they could work in different domains. From Canada being the first country to adopt them at the national level under the Directive on Automated Decision-Making for use in public sector departments and agencies to understand and manage risks from automated decision systems, to the UK's National Health Service AI Lab, which Laura mentioned, who've committed to trialling AIAs as part of the data access procedure for NHS health data. And we've been lucky enough to work with them in developing that process. And they're also increasingly becoming both a part of policy and legislative discussions, questions as to whether or not they should be mandated or how they might fit into other legislative processes, but equally attracting interest in industry amongst teams who are looking for practical methods for considering impacts. With all this exciting work underway, there's still a lot for us to learn about how algorithmic impact assessments could work, if and when they do work, and how they could work best. For instance, who's best placed to conduct an algorithmic impact assessment, and when should they conduct them? Who assesses that assessment? Who's able to evaluate the contents of an algorithmic impact assessment? And how can we ensure meaningful participation of the public and affected communities in defining and identifying those impacts? I'm really excited to hand back to Laura to guide us through that conversation and answer some of those questions with this brilliant set of experts here today.
Perfect. Thank you so much, Denny. I think you touched upon the really kind of exciting juncture we're at the moment in terms of AIAs and thinking about how they might best work in practice. That I'm really looking forward to drill down with our 4 fantastic guests who I'm going to introduce now. So joining us today is Brimi Balaram. Brimi is the Head of Research and Ethics at the NHS AI Lab, our research partner for this project. Brimi and the lab have had a particular focus on tackling inequalities that may emerge from the development and deployment of AI and maximising the benefits and minimising the risks of AI in healthcare. We also have Benoit Deshay. Benoit is Acting Director of Data and Artificial Intelligence for the Treasury Board of Canada Secretariat. And he's been involved in the standing up Canadian government algorithmic impact assessment that Jenny spoke about, which is, of course, the current only live example of an AIA anywhere in the world. Next, we have Dr. Zhao Liu. Zhao is a clinical researcher in AI and digital healthcare at the University of Birmingham and University Hospitals Birmingham Trust, with expertise in developing clinical reporting standards for AI in healthcare. And lastly, Dr. Emmanuel Moss. Manny is a joint postdoctoral scholar between Data and Society and Cornell Tech, and Manny's been one of the lead researchers spearheading AIA scholarship, and he also conducts ethnographic research on issues of fairness and accountability in AI systems. So welcome all, and another note to say, we're kicking off straight into discussion around AIAs and the implementation. Just a reminder to attendees that we'll be taking audience questions towards the end of the session. So please encourage you to add all your questions into the Q&A box, and we'll try and get through as many as we can at the end. So without further ado, I'm going to kick off to the first question. This one I'm going to direct at all speakers, but perhaps Benoit, you want to kick us off. And the first question is, what's needed for algorithmic impact assessments to be adopted in a variety of contexts? What are the kinds of considerations policymakers and researchers should be thinking about? Benoit.
Thank you. Thank you for the question. So for us in the Canadian government, the AIA, the Algorithmic Impact Assessment, already applies to a fairly broad set of decisions, which are administrative decisions for the clients of the government. And this could be for systems that help decide a wide range of things like who's eligible for employment insurance, which companies are granted radio licenses, which immigrants will get a visa to come to Canada, whether a proof of vaccination is acceptable, or which candidates should be selected for a job opportunity in the federal public service. So we focused on service delivered by the federal government. Our AIA doesn't cover, however, anything that's done by industry, in the health sector, by banking and finance either, which would be private sector. So for AIAs to be adopted in a variety of contexts, we must design them to be broadly applicable. And that's what we've tried to do, given the range of services offered by the government. And I think most questions asked by the Ada Lovelace and NHS AIA are broad and meet this objective. And other questions with a slight tweak could be adapted to meet that objective. So for example, instead of asking about the relationship between patients and care provider, we could talk about clients and service providers, more generic terms, and then the question would be applicable broadly, in other sectors like banking, for example. But there's also a need for specialization. Different domains will present different risks. So we focus on administrative decisions, and I think health has a lot of the same concerns. We're concerned about differential outcomes across groups, so the bias, but also being able to explain and understand decisions is also very critical. But if we look at other use cases like physical automation, for example, whether it's self-driving cars or agricultural tractors or maybe automatic doors, there's going to be a different set of issues. It could be about safety, for example. The machine should not amputate your limbs, or it should not ruin your crop. So having a common base, I think, is important with generic terms, but then also domain-specific extensions.
Great, thank you, Benoit. I think you've touched on something really important in terms of thinking about how AIs could be broadly applicable to a variety of sections, but maintaining that kind of specialization piece and thinking about the kind of domain-specific risks involved. I'd love to turn the question actually to Zhao and Brimi to get the kind of health angle on this question. What do you think about what's needed for AIAs to be implemented in the health sector? Perhaps thinking about those kind of health-specific risks that may emerge from kind of the applications of AI in healthcare. Maybe Brimi can kick us off, and then Zhao.
Yeah, so I think to answer that sort of broader question about what's needed for these assessments to be adopted in a variety of contexts, I think that we first need to build the evidence base that impact assessments do make a difference as part of development or commissioning processes for AI before we can mandate them through regulation or recommend that they are widely adopted by various organizations. But specifically within healthcare, I think that they could be adopted in a variety of ways. So for example, I think that they could be adopted early on in the development process for AI as a condition of data access, or that they could be adopted as part of a commissioning process once an AI system is ready to be deployed. It could also be possible to first conduct an AIA as part of a data access process and then follow up during a commissioning process so that we have that sort of end-to-end scrutiny. And I think it's actually easier for me to envision an AIA being adopted by a national body, given that I work for the center, but I could also see potential for local bodies, such as some hospital trusts, for example, to use AIAs as part of the commissioning processes. I think that the upside to this is that they could involve members of the local community and the participatory element. But I think that the risk is that these assessments may not be implemented consistently at this level, given variations in resource. I also think that there's potential for other types of bodies within healthcare to incorporate elements of an AIA. So for example, I'm thinking of the Health Research Authority, which is a regulator. So they already require some degree of patient and public involvement from academic or corporate researchers applying for access to patient data for research purposes. But I think that they could use similar prompts found within an AIA to encourage reflection on specific ethical considerations. I also think that the users could change. So we've designed this specific AIA for researchers and developers to complete, whereas I think in the Canadian example, it's public sector employees who are the commissioners that are completing the assessment. And ultimately, I think that deciding on how an AIA should be adopted is going to come back to the specific context, given how much scope there is for variation.
Thank you, Marie. Zhao, up to you.
Yeah, no, I completely agree with a lot of what Birming's covered already. I mean, it's just as an aside, I think undergoing the AIA process as a thought process is a really good thing, because I think it addresses a really important question, which is should we even trying to address this clinical issue with an algorithm at all? And I think it's very difficult to put out guidance that mandates that kind of thinking, but what the AIA offers is a structured way of going through that and asking the right questions before you access any data, before you develop the algorithm at all. I think very similar to what Birming was saying is that we have a very structured system of regulation and commissioning and decision making within healthcare already. And for successful adoption of the AIA, and in fact, any guidance in this area, it's really important not to overburden those who are going to be carrying this out. So as much as any new guidance can be aligned to existing guidance, and for there to kind of be efficiency, if you're doing one thing at one stage, whether it be the data access stage or the health research authority stage, if we're motivated by the same things and actually we're asking for very similar things, then to try and streamline that process makes it easier, and also share information between those different bodies also makes it much easier for everyone.
Yeah, I couldn't agree more. Zhao, definitely that notion of kind of building share capacity across both kind of bodies within health and also broader sectors will really kind of build out that kind of interest and also practical capacity in AIAs. And Bruni, I loved your point about we need this kind of end-to-end scrutiny, and that AIAs might function really well at the kind of early development end, but we also need kind of other mechanisms to slot and ethnographically layer over to build out that kind of complete ecosystem view. So yeah, definitely agree with those points. I want to flip the question a little bit and now I'll go to Manny and ask whether you think, Manny, there are any contexts that AIAs are not ready to be adopted, given that, for example, a sector like health is already very well regulated, and there's quite a lot of current existing regulatory initiatives in the space. Do you think, is your view that like a sector like that, does that hinder implementation of an AIA, or might it actually benefit it? I'd be really keen to get your kind of lens on that.
Yeah, I think that Well, in reference to the kind of the broader question of what is needed generally, that kind of guides whether or not specific contexts are or are not ready for adoption of AIAs yet. And I think that generally we still don't have a lot of consensus about what a good AIA consists of or what should be elements of that. Now, consensus could come out of the form of government stipulated regulations calling for specific components to be part of an AIA. But we could also see consensus come out of contestation between stakeholders, people who are conducting AIAs, people who might be in a position to challenge the results or the methods, and to propose alternate processes and methods. I think outside of a purely public sector context, when you see private and public sectors starting to engage in AI processes, that kind of room for consensus emerges, and lets us think about what the kind of methods of algorithmic impact assessment ought to be. What is the best way to figure out whether a algorithmic system will chop somebody's arm off if it's being used in an agricultural setting, for example? How would you establish that? And also to start to lay out what the relationships within which accountability rests ought to be. So most contexts aren't ready, I would say, because the methods and accountability relationships aren't developed enough yet. And this is particularly true in contexts where there's been less eagerness about accountability generally. So in industry, you see some companies trying to distinguish themselves in the market through engaging in accountability practices. You see some actors kind of going through the motions, kind of ethics washing or accountability washing. And you see other actors who have no interest in accountability and likely won't be until they're compelled into compliance. So AIAs really need to solve for all of those actors. And there's very few contexts where that's possible at the moment, I would say. Healthcare, though, I think is the exception to that because it's one of the contexts where it's easier to include everyone because of the history of compliance, rigorous assessment, compliance testing, and all of the other infrastructures that create these accountability relationships to slot AIAs into.
Yeah, thanks so much. Definitely that point around AIAs trying to be like all things to all people, particularly with not that kind of differing understanding of what an AIA can or should be, that we're not quite there yet, is really interesting. Just to ask a follow-up question, how do you think AIAs will be adopted in private sector context? Do you think it has to be a kind of mandatory, a mandated mechanism, or are there kind of other sort of compliance or carrot and stick levers that we might be able to pull?
Was that a follow-up for me?
Yes.
I think that's a great question. I think that the most robust forms of impact assessment are going to be mandated in some way because that provides a common benchmark, a common set of requirements to document and to make elements of an impact assessment publicly visible, publicly accessible, perhaps require public participation in the conduct of the impact assessment, as recently proposed regulation in the US calls for. But there's no hard and fast law of nature that says that there must be a government law to require these. There are certainly industry actors who are looking to undertake these practices on their own, and different stakeholders, community advocacy groups, industry specific companies in industry trade groups could be working together to kind of demonstrate what is possible in this framework in ways that serve both their own interest and serve the goals of accountability in advance of a hard and fast regulatory requirement.
That's really great. I don't know if anyone else wanted to come in on that and the idea about AIAs being in law. Perhaps Benoit, you might want to speak with your Canadian hat on in terms of what the kind of necessary steps for you were and any learnings from kind of mandating the AIA.
Sure. And I just want to make clear from the get-go that I don't make laws, like that's not my role, or to regulate industry. So my comments would be from the perspective of a regulatory agency for the operations of government. So slightly different setting government policy, but still mandatory, instruments, mandatory rules. So it's very similar. In my mind, should AIAs be mandated? I would say yes. because many would not do it unless it's mandatory. There's various pressures to avoid doing it, whether it's cost reduction, time to market, or simply not being aware of, that it exists or why it's important. And a mandatory tool addresses that. We made it mandatory for the federal government, and that resulted in more AIAs. I can say confidently we would not have completed some of them if it had not been mandatory. It needed some, awareness and convincing of people. So certainly some would not have been made if it was not required. By making it mandatory, it also serves an important role for education. So most people are not aware of the issues in this field. They haven't read, the books like Weapons of Mass Destruction, Invisible Women, and so on. The majority of people haven't heard of AI bias, or they haven't considered how unexplainable systems might be a problem. So by making it mandatory, it's making people pause and learn about these things, see why it's important, and then it changes, behavior and culture. So how would we make an AIA, come into law? Well, I don't make laws, but and the political aspects of Parliament are certainly a mystery to me. But I can say from policy that we need a mature proposal that's been tested. And I think starting with a voluntary measure is useful in that to show, as was said earlier, that it's effective. We need to consult it widely with experts, but also those that are impacted. And that includes both the clients of the algorithms, but also the corporations or the organizations that would have to complete an AIA. It was touched on earlier as well, like we need to not overburden them with these processes. And we also need to have a specific scope when we apply these things. So there's some use cases of algorithms that don't pose the same risks. So we don't want to create additional bureaucracy when it's not needed. Like if my restaurant here adopts an AI to propose better curries to me, like that doesn't probably need to complete an algorithmic impact assessment. The impacts are very minimal. So we would have to be precise in where we apply them.
Really great point. I think I hadn't really thought about using kind of legal levers to kind of drum up that kind of institutional understanding and also public understanding. So that's a really interesting point. How, I suppose, in absence of a legal mechanism, this is a question just for the general group, what kind of other levers do you think can be used to like build up that kind of scrutiny and that accountability? So, for example, in our study, we've recommended that the NHS AI Lab implement a data access committee to review and scrutinise AIAs, but just would be interested to hear if anyone had any other ideas about how to kind of build out that understanding of accountability. That's a general question to whoever.
So I can come in. So actually, I want to link this to the question that you just asked about mandating AIAs through legislation, for example. So I think I'm a little bit hesitant at this stage about governments mandating algorithmic impact assessments because I still think that we lack the evidence for their efficacy. I also think that it's more complicated in practice to mandate certain elements like the participatory element. So a recent example of this was actually in relation to the National Data Guardian's proposed guidance on public benefit. So one of the concerns raised was that it was trying to mandate patient and public involvement as part of all public benefit assessments, and that this could be burdensome for smaller organizations such as hospital trusts, for example. And while this isn't a criticism that's specific to AIAs, I think that it's a concern that could similarly be raised if we were to assume that AIAs were a one-size-fits-all model. And I think that in relation to your second question, the way that we're going to start to raise interest and hopefully build practical capacity is if we're first able to demonstrate the value of introducing AIs within different contexts. I think that there actually has been interest in AIs for a long time now, but that we lack and still do lack a clear understanding of how they work in practice and whether they meaningfully change outcomes. So I think that some of the practical advice that we can offer for others that are potentially exploring adopting AIAs would be that they should consider whether this is an appropriate mechanism for meeting their objectives, whether and how it could fit into existing processes without leading to convolution or possible duplication, and if they have sufficient resources to trial or embed this practice.
Thanks, Brumi. Yeah, sorry, Zhao, go ahead.
Yeah, if I could just jump in with 2 quick comments as well. I think I'm also with Burmi on this, and that I'm a little bit hesitant around mandating this into law. And there's 2 reasons for this. I think what we want from people doing AIAs is that we don't want them to do it to tick a box. We want them to do it well, right? Otherwise it's meaningless. And the problem that I see with the AIAs is that we don't have a good bar to measure against, whether it's done well or not. And it's not something that's very easily auditable. And so if we mandate it, what mechanisms do we have then to know whether it's been done to actually serve its purpose or not? And if we don't have ways to do that, then is it just counterintuitive to mandate? The other thought I had was that the way that you perceive the benefits and harms of an algorithm may be very different from at the beginning of the development stage, maybe when you're accessing data, to when you actually come to deploying it in healthcare. And these things evolve. And so you can, along that journey, think of ways to mitigate risk from not the way that you shape the algorithm, but how the humans work with it. So how the clinicians can mitigate risks and redress any biases or harms that it might impose. And so actually then are we also talking about mandating humans within that AIA? And I think that then becomes very difficult and very context specific. So I wouldn't know how that would work. So those are 2 problems that I see.
Sorry, Benoit, go for it.
Yeah.
Okay, I'll go first. You've asked a good question. How can we know it's done well? And I think the public needs to play a role in this when we deploy new automations, or if we mandate, the publication of AIAs, for example. They can be the ultimate judge of whether it's done well, asking questions about the automation, but asking about the steps that were taken to understand and manage the impacts. And I think, this helps build interest, but also capacity. So if organizations see these questions coming from the public, they see that there's interest, it creates an incentive to invest more into these AIAs. Education, I think, also needs to play a key role in this. So I would hope that all STEM programs would include a course on tech ethics, for example. And for us in algorithmic ethics or responsible AI, or however we want to call ourselves, it's important to make the link to priorities and values. So it's not so much about technology, but it's about equality, diversity, inclusion. And I say these words, in that order because that's how it's stated as a priority in Canada. But I assume this is a shared value, and in the UK and other countries, these would be equally important. We want solutions that work well for everyone, and that's part of the message. So I think that's also how we bring this.
Yeah, I think I am in broad agreement with everyone else on the panel that that much more needs to be done before there can be effective legal mandates for algorithmic impact assessments. But I would like to, I guess I would like to distinguish myself a little bit in saying that I'm all for the calls. I'm all for calling for regulation right away, as long as that regulation acknowledges that we're not there yet. Even if the Algorithmic Accountability Act in the US were to be passed tomorrow, we wouldn't know how to conduct an algorithmic impact assessment. The laws themselves should kind of leave some of that lead time in order to establish the kinds of methods and evidence bases and implementation guidelines that everybody else on the panel is suggesting. The other thing I kind of want to point out is that even with a legal requirement to do impact assessments in place, or really any compliance mechanism in place, lawmakers still rely on industry, on developers themselves to take on a lot of the responsibilities of compliance, to work out the details of implementation themselves. Andrew Selbst at UCLA has written about this very persuasively. And so the legal mechanism itself only goes so far. The assessment practices have to become what he calls endogenous to companies in some ways. But the trick, like everybody on the panel, I think, is indicating is figuring out how to make sure industry isn't creating its own homework across the board to bring up the level of accountability across the industry.
Yeah, I think that's absolutely right. I think we have to avoid this kind of like entirely self-assessed piece with an AIA. There has to be that kind of institutional levers and compliance. And it sounds like everyone's kind of in agreement in terms of thinking that having to communicate the value of AIAs, so they're not seen just as a burden, but they might be seen as an enabler, particularly to like tech development. Yeah, that's really great. How I would love to touch a little bit now on, maybe this is a question for Zhao, and then the others feel free to come in afterwards. But we've touched on it a little bit, particularly with the kind of health lens, but I just wondered if you wanted to shed any insight on how algorithmic impact assessments, in your view, might complement kind of existing regulatory and government steps, particularly maybe in the healthcare space, like AI standards or audits. How do we avoid that duplicity? And also how are the ways that AIAs could move beyond that sort of compliance like framework?
Yeah, that's a really good question. So the way I try and think about this in my own mind is to map out kind of the life cycle of the algorithm and then all the stakeholders or gatekeepers that kind of come along that pathway. And there's lots of different guidance that have been developed in recent years. So we've got reporting guidelines for clinical evidence. For example, the Spirit AI and Consort AI guidelines, which we worked on for AI clinical trials. There's recently published the good machine learning practices jointly between Health Canada, the US, and the UK's MHRA. There's, I'm trying to just make a quick list now. There's the kind of NICE evidence standards framework for digital health technologies, which includes AI and is soon going out to public consultation. And the way that I see this complementing is that this sits very proximal within that life cycle. So it's kind of at the data access stage and the problem formulation stage, but I think it's worth revisiting throughout all those different stages as the clinical problem kind of gets kind of evolves as you accumulate more and more evidence. I think in terms of how it could sit nicely along other guidelines, I think is to identify areas of overlap and to try and use a common language where possible, because there are lots of areas of overlap amongst all of these new guidances. And I think we don't want to create unnecessary duplication, and also to be able to foster ways of sharing that information. Like one of the problems that we have at the moment is that there's lots of clinical evidence that gets that is produced to support market entry with the regulators, but it's not all openly available. But actually, a lot of that clinical evidence and a lot of the kind of discussion around foreseeable risks and the risk mitigation steps are really useful for the stakeholders on either side of that pathway. And so if there are ways that we can open up the channels of information sharing, I think that would be very helpful.
That's really great. I think definitely you speaking about how an AI might assist in that kind of problem formulation stage is really interesting. And perhaps maybe we'll turn to Benoit on this, because obviously the Canadian AIA is perhaps more of a sort of procurement end and like just at the point of deployment AIA. So I'd be interested to hear kind of your thoughts and whether an AIA could kind of suit and respond to the sort of problem formulation context, or whether you think it's better to appear perhaps slightly later on in the development cycle.
So for us, we really see the AIA as being important really early in the design stage. The way our directive is structured is that the output from the AIA, yes, it's to identify, the risk of the system and the potential mitigations for them, but it also gives you an impact level. So from 1 low impact system to 4 high impact, and then that will drive the requirements that the directive will require. So the measures that must be taken to manage those risks. So it's really early to do it early on, so that in the course of development, you can plan the mitigation measures that you will implement. It's important to know to what extent the requirements need to be met and which one and how. So we do it early in the design stage to help guide the evolution of and the development of the project. But also before the production, before we launch the system, we revise it to make sure that what we documented early on matches what we actually built. We know in the course of development, we have to make decisions. You know, some of things that worked in design, when you try to build them, it doesn't work, so you need to adjust. So we revise it before the publication. And then once the system is in production, we have a monitoring requirement to make sure that biases don't develop and all that. But as well, if you make changes to the system, you change the training data source, you change the algorithm, then you should revise the algorithmic impact assessment to make sure that it's still accurate. So it's a little bit of a continuum, but we stress the importance of doing it early on to identify how you will develop the project to manage the risk.
Yeah, I would agree with that. I think having it, if you're having the AIA appear at the problem formulation stage, you kind of need to keep that sort of iteration, that kind of ongoing learning, particularly if you move into sort of post-deployment phase to kind of confront the kind of hitherto unaddressed impacts. Maybe on that, maybe this is a question for maybe Manny and then whoever else wants to come in. What might a kind of purely post hoc algorithmic impact assessment look like? Is there a way that we can completely flip it on the other foot and say, okay, we're going to just like use it as almost as like an evaluation piece, much in the style of something like a human rights impact assessment for technology, which traditionally have been kind of backward facing? I just wondered if you had any views on whether that would work at all.
You kind of took the answer right out of my mouth. I think a post hoc algorithmic impact assessment would look like a human rights impact assessment, where it is done, well, depending on what kind of legal mechanism called for it. Human rights impact assessments tend to be done ad hoc. A company decides to do it because they want to examine their logistical supply chain or the rollout of a product in a specific market and try to understand what the human rights impacts of that action were, and then to make changes accordingly. I think that the kinds of scales at which algorithmic systems operate kind of makes it more important to do a ex ante impact assessment, to know what you're about to put out in the world before you do, because the effects can be so widespread. But it makes it all the more important to have a post hoc element to that impact assessment. So I think that one without an ex ante impact assessment without ongoing assessment is insufficient. And I think that a post hoc impact assessment is not sufficient as well. I think that for systems that are already out there being deployed, we should certainly be thinking about post hoc assessments or the evidence generated by audit practices as ways of feeding in to how we might start thinking about ex ante and continuous impact assessments. But I don't know that post hoc gets us where we want to be.
That's great, thank you. I think, yeah, that your point speaks to Brimy's earlier kind of intervention, that we need the kind of end-to-end scrutiny. And yeah, if we're having a post-hoc, we need some kind of continual learning, and then if we're having ex-ante, we need also that kind of feedback loop going on. I wonder if we could move the conversation a little bit to AIAs and their role in building transparency, and thinking about, maybe I'll come to Benoit first and then maybe to Brimy. Thinking about who the target audience for a publicly disclosed algorithmic impact assessment might be, and how might we make an algorithmic impact assessment relevant to that audience?
Thank you. Yeah, I think ultimately the audience for an algorithmic impact assessment are the clients that are impacted by this. But if we look at the goal of an AIA, first is to identify the impacts of decisions or algorithms on people or organizations, but also to guide their efforts to minimize the impacts that would be negative. Publishing an AIA, first of all, not all AIAs will be published, but by publishing it, that serves many purposes. It increases the quality. We know people, take more care when they know that their work will be made public. It informs the public, it creates accountability, we touched on that earlier, and it also helps build trust in the organization that publishes it in the system. But what do we need for the AIA to be relevant to the users, to the patients, or the clients? Well, I would say, first of all, for most people, they're probably not interested in reading an algorithmic impact assessment because they're just not worried about the system in the first place, right? But for those that are worried about the system, the AIA should be available. And it should also be available to researchers and journalists, for example, as a check and balance, and they can question, the measures taken by the organization. And if we talk about the people impacted by the system that may be worried about the system, so we need to anticipate what their worries could be, and it could be things about safety, fairness, privacy, and so on. And the AIA needs to speak to that for the AIA to be relevant to them. So I think that's an important aspect, is to try to anticipate that. And of course, a good way to do that is to talk to potential users that would be worried. And also, for it to be relevant, I think it needs to be part of broader measures to communicate a responsible approach to the implementation of the system. So this would include other assessments like the privacy impact assessment. In Canada, we have a framework also called the GBA Plus for gender-based analysis plus, but the plus encompasses all the differences between clients. So it could be their marital status, their age, sexual orientation, race, and so on. And just generally all the testing and evaluation that's done. So in summary, I would say, for the AIAs to be relevant, it needs to show the public that we're also worried about the same things that they are, and the AIA needs to speak to these aspects and how we've addressed them.
Yeah, that's great. That's that point around maintaining that kind of understanding of what the public needs from an ANA and kind of engaging them directly is really important. I'd love to bring the question to Brimi about how you see the value of publishing an AIA, both for maybe members of the public or patients, and to use the NHS example, but maybe also for a developer working in a health tech company, who may be a little reticent to kind of publish an AIA. Do you think they'll be able to see the value of kind of being transparent around the AIA process?
Yeah, I should hope so. We did have this discussion early on in the project because there was some initial hesitation about publishing all the AIAs, but we did get to a point where we had agreed to publish them. I think that it's just going to be a matter of whether some information has to be redacted because it's commercially sensitive, or yeah, I think we'll figure that out as we go along. But we do feel like it is important for patients, the public, and healthcare professionals to see what was included as part of assessing the algorithmic system before they gained access to the data. And that similarly, for a lot of developers and other people in the industry who may not be as familiar with the ethical implications of these technologies, I think that these could serve as really great case studies or prompts for supporting people to better understand these sorts of challenges.
That's really great. I think I agree that there has to be the kind of being able to communicate to developers that they don't have to necessarily reveal like the technical attributes of the system, but there's still value in kind of being transparent around the process of thinking through ethical considerations and social impacts to kind of enable that sort of broader learning across the ecosystem. Yeah, I definitely agree with that point. Okay, we've got maybe 1 minute before I want to move to general attendee Q&A, but maybe if I just throw in a quick higher level question to everybody, which we've kind of touched on a little bit, but I'd be keen to drill down very quickly, is how should the public participate in an AIA? Maybe Manny, you're smiling, maybe I'll go to Manny first, and then yeah, from you talk about the AIA trial or anyone else.
Yeah, sure. One of the things we found in our research at Data and Society is that every form of impact assessment we looked at, there was some sort of public component, whether it was public disclosure or public comment period. The public figures as a constitutive component of impact assessment. Because of the scale these systems are deployed at, because of like the autonomy granted to some systems or to certain aspects of decision making or classification, it's really important that not just the general public, but putting on my social scientist hat, the specific publics that coalesce around particular dimensions of algorithmic harm. So particular communities that are implicated in specific kinds of harms have a role to play in this work that it takes to anticipate the issues that are of concern to them, as Benoit was mentioning. This means like not working from a standard list of impacts that we expect to be of concern to everyone, but trying to incorporate communities' concern into a list of potential impacts that should be assessed in context, and the need to generate methods for engaging communities that are implicated in algorithmic systems in equitable ways, using participatory research methods, generalizing this process so that insights can be transported between different products, even if they're in the same context, so that you don't have to reinvent the wheel every time you start this process, and empowering existing community advocacy organizations that are already active in this space to bring their questions as categories of impact to these processes.
Awesome. Yeah, I think you're right in the sense that we don't necessarily need to reinvent the wheel and utilize the existing kind of on the ground expertise from particularly advocacy organizations to possibly kind of crowd in that rich lived experience and different perspectives is really important. Very quickly, maybe we should go to Brimi and then I'll open up the floor to questions. Thank you.
Yeah, so like Manny said, I think the public participation element to an AIA was something that was always stipulated as integral, but it wasn't very clear how it should be actioned. So this is actually in large part why we wanted to work with AIDA, so that we could further explore this specific element and in particular. So our plan is to set up patient and public panels with the involvement of healthcare professionals to explore the possible impacts of an algorithmic system with researchers or developers. So we'd be drawing on deliberative methods here. And this would in turn inform the decision of the Data Access Committee to grant the researchers or developers access to medical imaging data for the purposes of training or testing their algorithmic systems. And so the idea here is that the AI lab would standardize the participatory process, and this was seen as something that was advantageous by potential users who noted that organizations and companies their levels of engagement with patients in the public tend to vary a lot because of it can depend on the level of resource, for example, that's available to them for this type of activity. And I actually just wanted to mention that we're going to be hiring a patient and public engagement manager to support the trial. So we're currently accepting expressions of interest internally, and depending on interest, we're going to go out to recruitment externally. But if anyone in the audience thinks that this sounds like something you'd be interested in, please do keep an eye out for the vacancy over the next couple of weeks.
It's so great to hear such enthusiasm for public participation amongst this group. It's something we really passionate about, Ada, and great. But I'm so glad that you've plugged the participatory facilitator job. That will be a really awesome role. So anyone, if you're interested, do keep an eye out for that. Okay, I think we've got about 10 minutes-ish for questions. So I'm reading them slightly on the fly. So I'm just going to throw them out, and then if anyone in particular wants to pick them up, you can just dive right in. So we had a good one around how can AIA scale? So an audience member has mentioned a recent survey by Health Education England, which identified over 250 AI technologies for health. Can proposed approaches scale to support this number, and how will institutions like the NHS support that scale? Maybe Brimi or Zhao, you want to take this one?
Sure, yeah. So I think this is why I mentioned earlier that I felt that this process made sense to me in terms of thinking about it as like a national or centralized process, as opposed to something that local trusts could carry out, because we do have that sort of sufficient scale within the UK. We do have that sort of level of resource and like the power to standardize these processes. So at the moment, I see this as something the center takes on.
Yeah, I'm not sure I have anything really clever to add, and I'll start sounding like a broken record, but I think the more that you can you can share resources across the other things that these companies have to do, the easier it will be. And hopefully we get to the point where actually the developers will know exactly what they need for the entire pathway, and there'll be, it will be very easy to anticipate. I think at the moment it's very difficult because we keep adding things, and it feels a bit like there's an endless trove of standards to meet. But I think, as much as possible, if we can cross-reference other guidance.
That makes a lot of sense. Yeah, it's that centralization piece coming forward quite strongly. Thank you, Brimi and Zhao. We have a question from an audience member in the US, thinking about whether AIAs could be used for policing tech and whether there's precedent there. I'm immediately thinking about Andrew Selb's early work on kind of AIAs in possibly in policing. So I wonder if Manny, you had any idea, or perhaps Benoit?
I mean, I can be exceedingly brief and say yes, there should be impact assessments of policing technologies. Unfortunately, a lot of proposed legislation carves out criminal justice, or at least public safety in some respects, not all. But yes, they could be incredibly useful. They can draw attention to not only issues of disparate impact in policing across racial or gender lines, but also around the fundamental epistemological basis of these tools. We've seen algorithmic systems based on earthquake tracking be used for crime prediction, and that could be revealed in a robust impact assessment process. And some questions can be brought to kind of the basis of knowledge that some of these systems are built on, and that would be appropriate.
And just building on what Emmanuel said, and I agree with the answer there. But often a concern in either policing or national security systems is that completing an algorithmic impact assessment and publishing it would disclose information that would let people cheat or avoid detection, for example. And we believe it's possible to conduct an algorithmic impact assessment and to publish it without disclosing the specific rules or the details, but focusing on the type of information that's used to inform it, how the system will make recommendations informing officers, for example. So focusing more on the processes, you can complete and publish the algorithmic impact assessment without disclosing the secrets. So yeah.
Great, thank you both. Another question here. These are some really great questions. Thanks everyone for submitting them. We probably won't have time to go through them all, but I thought this was a really good one. Does the panel think the EU proposals on AIAs will be effective? And that kind of like conformity assessment piece in terms of thinking about kind of horizontal applications of AIAs. Does anyone have any thoughts? If not, can move us on.
I would just quickly say it depends what you mean by effective, and the jury's out.
This is true. This is true. Great. Okay, I will move us on. Sorry, I'm just reading these on the fly. Another question for the kind of general answer. What type of evidence do you think that we need to demonstrate the efficacy of impact assessments? How can we build out that understanding of what good looks like? What's the kind of real granular evidence that we need to build that?
I can have a go at this one. So one of the ways that I would like to see AIs have impact is translation into some kind of action that may be documented in somewhere else. So sorry, that's a bit vague, but what I'm thinking of, for example, is if you're within your AIA, you identify a number of risks. What I would like to see is that then becomes joined up in, for example, your risk management system that you submit to the regulatory body, or in the way that you educate the clinicians that are using it, or to drive some of the questions that you ask in your clinical trial. or some of the priorities, that you monitor for post-deployment. So that kind of translation of you identify a potential problem, and then you find other ways further down the line to mitigate it. And I guess one step further from that is to see the successful mitigation of that risk, but that becomes quite difficult to evidence the absence of a risk, right? But that translation to action for me would be a good way.
Can I add something on this question as well? So I think that we need to better understand how integrating impact assessments leads to change on the part of users, and in turn, how it benefits those who may be potentially affected by the deployment of the technology in question. I also think that we need to better understand if there are trade-offs to their adoption and whether the benefits outweigh the potential drawbacks. So for example, does lengthening the data access process and introducing more conditions for users to meet ultimately deter some researchers and developers from making requests in the first place? I mean, it may be that is possible, but it's just about trying to weigh up those risks and benefits.
And if I can add, I think there's an intangible aspect we'll never be able to truly measure, but we've spoken and others in the panel as well on the the important discussions that take place as part of the AIA process. So stakeholders getting together and discussing potential impacts. And if we do this early in the design, this helps shape the design. So I think that does take place, but measuring that impact could be difficult. You could consider maybe two different systems, one that didn't complete an AI, one that did, but that would be academic in our case because it is a mandated tool, so you need to complete it. But I do think they're effective. I see these discussions taking place and they're very rich and very interesting for a lot of stakeholders. So there's some benefits that could be hard to measure. So the fact that we can't necessarily measure doesn't mean that the benefits are not there necessarily.
Manu, do you have anything you'd like to add to this question?
No, I mean, I was very interested to hear how everyone on this panel answered that question, because that's something I've been thinking about quite deeply as well, but don't have any really good answers. The one thing I have thought of is that one way to start to get at the effectiveness of impact assessments is to look at changes to the design of the system itself. So if the impact assessment leads the designers to make a change around the specifications, the implementation, or the operating parameters of it, you can start to look at what those changes were and see how they might have been guided by the impact assessment itself.
Fantastic. And okay, we've got 2 minutes left, so maybe we'll go for one more. So next question, what are the incentives for companies when not mandated to do an AIA? How about we go to Brumi or Zhao, and then maybe Benoit or Manu can come in afterwards?
Yeah, so I think the incentive in our case is that they won't be able to access like the medical imaging data unless they complete the AIA. So that was one of the reasons why we designed it in this way, because we're not mandating it like through legislation or anything like that, but we're basically saying if you want access to this very incredible, like incredibly valuable data, then you need to complete this.
I guess the other thing is that by doing the AIA, it may answer, or at least trigger your thinking in something that you may encounter further down the line. So for example, you may only be at the data access stage, but then, once you've done that bit and once you've moved on, you might be required to answer questions around potential impact on equality, for example, at the commissioning stage. And so if you've already done some of that groundwork, then actually you're saving yourself some effort there. And it's likely that at some point before deploying into a patient cohort, you're going to have to answer some of these questions. So by doing it in a structured way, at least, it's not brand new.
Any thoughts from either Manu or Benoit?
I don't necessarily regulate industry, but from discussions with some in industry leading on this kind of work, One of the drivers certainly seems to be reputational risks. So companies want to be seen as ethical and, they certainly, for a lot of them, understand the issues and the concerns and want to address them. They want to deliver good products, good services. So that's certainly an incentive there. And over time, there could be also, given the chance, if the ecosystem grows, it's a differentiator. So if your company addresses these things proactively and other companies do, they may seek each other out for goods and services. So there could be a differentiator there as well.
I would just add that there might be something on the demand side as well. If communities start asking for these before they will engage with the systems at all, that could be another lever in the absence of regulation.
Awesome. We've gone 1 minute over 5, so I think we'll need to round it out there. But I want to say a huge thank you to our panelists for a really fantastic session. It's been a lot to kind of chew into, and thank you to all our attendees for your excellent questions. And if you want to hear more from us, I'd recommend that you subscribe to the Ada Lovelace newsletter, which you can sign up to on our website, or follow us on Twitter. But for now, I'll wish you all a pleasant rest of the day and see you all again soon.